title of our presentation is Increasing Efficiency in CT Trauma Scan Workflow Experience at a Tertiary Center, University of Wisconsin Hospital System. My name is Erika Wood, and these are our relevant disclosures. So our QI project addressed the following problem statement. There was a disconnect in the ED among trauma surgery physicians, where they noticed that it was taking an abnormal amount of time to receive CT results in trauma cases. So obviously this is important because delays in imaging results, particularly in the case of trauma, could delay life-saving treatments. So our goal was to decrease the duration between CT, trauma, abdomen, pelvis scans being completed to preliminarily dictated in PACS from baseline evaluation over 15 months. So we initially looked at CT, abdomen, pelvis workflow in the ED and changed this from manual technologist reformatting to auto reformatting and auto sending the images to PACS in December of 2019. Our study design was a single center prospective study comparing turnaround time and other quality metrics in trauma CT scans. Our study group included 17,709 trauma CT scans in the pre-intervention period, which took place from 2018 to 2019, and 13,169 trauma CT scans in the post-intervention period from 2020 to 2021. We had 5,785 patients in the pre-intervention period and 5,055 patients in the post-intervention group. The data was pulled via Epic reporting database, the Philips Performance Bridge platform, and PACS and PowerScribe. Again, we did analysis looking at length of stay and other quality metrics. So this is the workflow pre-intervention, and then in the case of trauma, abdomen, pelvis, post-intervention. Instead of having the reconstructions manually created by the technologists and the images sent by technologists, they were now auto sent, and you can see that a couple steps were removed. These are the patient demographics, including the ED length of stay in minutes, which, as you can see, showed a decrease from 279 minutes to 237 minutes, which was statistically significant. Our results, our primary results showed that in the case of CT, abdomen, pelvis, the time from the end of the exam to the first report decreased from 31 minutes and 21 seconds to 29 minutes and 21 seconds. And it was statistically significant with a p-value of 0.008. We compared this to the CT chest as a baseline, which did not show any statistically significant decrease in time. So conclusions, automated reformatting and imaging delivery of specific CT scan types offers opportunities for streamlining workflow and should be considered in quality improvement interventions where feasible. Next steps, we're going to be applying this to CT chest to see if we can decrease the time to from image to report. Thank you.